Welcome back, everybody. We're coming back from the top. Ryan's behind the camera today, so you can't see him. But we brought Jordan Weiner, who's one of our partners, up this morning, and we hiked and came down the backside and thought we'd talk a little bit about one of his areas of expertise. So Jordan works with me in the office. He does a lot with sleep apnea. So Jordan, you want to introduce yourself and tell us a little bit?
Sure. My name is Jordan Weiner. I've been in practice in Scottsdale for 21 years, and I practice general ENT, but in the past few years I've taken a strong interest in the treatment of obstructive sleep apnea. It's as ENTs, we treat a lot of different things that vary in their ability to affect people's health and their quality of life. And what motivates me with sleep apnea is that, as an ENT doctor, is that this is a disorder that has profound implications and effects on people's quality of life, but also other major areas of their health, including their heart and their brain and their ability to live out their long and natural life. And because the treatment of sleep apnea has been problematic for so many patients for so long in terms of limited options, the recent development of some newer treatments has really provided us with a great opportunity to make a big difference in people's lives.
So if you run into 20 people on the street, how many people have sleep apnea?
The overall incidence of obstructive sleep apnea in people over 30 is about 25%, which is pretty staggering.
Now, can you tell who those people are just by looking at them?
A lot of times, if someone's heavier, they're much more likely to have sleep apnea. If someone has a very thick neck, they're more likely to have sleep apnea. But there are some thin people who have severe sleep apnea too, so you can't always go by their body weight.
And so if someone says, you know what, I'm chronically fatigued, I've seen my general physician, they haven't found anything wrong with me, I'm wondering if that might be the case. What's their next step, and how does that work for them?
Well, they should see usually a sleep medicine provider. Most of the time, that's where that would start, not necessarily with an ENT. To take a careful history and see if there are any other factors that would suggest they might have sleep apnea. Do they have significant sleepiness during the day? Are they falling asleep when they don't mean to? But also other things that might suggest the presence of sleep apnea, like an early diagnosis of high blood pressure. For me, when I see somebody who's in their 40s and has been recently diagnosed with high blood pressure, that prompts the question of, do you snore, and has your partner witnessed any irregular breathing? So that those would be things that would clue us in. But if they're very fatigued and sleepy, all by itself, that would be potentially a reason to do at least a sleep test and see if they may have sleep apnea.
So what's your opinion on sleep tests as far as old school? It used to be you'd have to go to the lab and get hooked up to a bunch of stuff, and now there's some at-home things. Can you tell us what our options are there?
Sure. It's a difficult subject because you're balancing convenience and accuracy, and you're balancing cost as well is another big variable, and insurance companies who have a keen interest in cost. So sometimes those things drive the decision, but basically there's a couple of ways you can evaluate someone's sleep. They're basically sleep tests. There is a home sleep test that can be done, and there's a number of home tests on the market, and then there's the gold standard, which is going into a sleep lab for a sleep study. The home sleep tests are reasonably accurate. It does depend on which one is being used, but they can be sometimes significantly inaccurate, particularly for mild sleep apnea. They tend to correlate the best when people have severe sleep apnea. So someone who does a home sleep test and has severe sleep apnea, you can feel pretty comfortable treating them with just that and not needing an in-lab study. If you strongly suspect someone has sleep apnea, but ends up having a normal home sleep test, it would still be reasonable to send them into the lab and do an in-lab sleep test.
So someone like myself, if I came to you and said, I'm fatigued, it's not because I woke up at 4 in the morning, would you tell me to go to a home study or a lab study?
For screening purposes, I happen to do a lot of home sleep tests because while they might miss a few cases of mild sleep apnea, the penalty for missing mild sleep apnea is not terribly high. The biggest penalty is for missing severe sleep apnea. So I think it's a reasonable starting point, and if it comes out negative, then I think you can look for other sources for the fatigue.
So basically, increased convenience and compliance and actually getting the study has a value, but you have to remember that if the symptoms don't match, you might have to do something.
Do a real
more.
sleep study. For a lot of people that I've seen, sleep tests have been recommended to them by multiple people over the years because of a very high suspicion and risk for sleep apnea, and the patients just never did it because they just didn't want to go into a sleep lab. And so the sleep lab became a barrier to getting diagnosed. And so a home sleep test for those people is often welcomed because it gets them diagnosed, and then you can put them on therapy without ever going into a lab.
So can you give us a brief rundown of the both lifestyle and treatments for sleep apnea in 30 seconds? Or no, just kidding.
Well, if you're overweight, the best thing is always to lose weight. And for most people with sleep apnea, their body weight is the number one factor. And as physicians, it's the one that we have the hardest time correcting because we can't really do it for people. But moving beyond that, the gold standard for treatment is still Cpap or some form of positive airway pressure. It's an air pump that you wear at night with a mask on your nose or your mouth. It works almost in all cases, maybe 99%. For people that PAP therapy just isn't something they can tolerate, you can get an oral appliance of some sort. This would be made by a dentist or a specialized dentist called a sleep dentist, and those can work for a lot of people. And if that's not a good option or that doesn't work, then we move into the various surgical options for obstructive sleep apnea.
So as far as the surgical options, knowing that I'm reasonably passionate about the nasal airway, does your nasal airway do much for improving your actual sleep apnea, or how does that fit in?
It's a good question. There's been a lot of research in that area. It plays a role, but it's usually not the dominant role. When a person breathes through their nose, it actually changes the position of the palate and the tongue base, and can affect the severity of their sleep apnea. People who have chronic nasal obstruction are actually more likely to have obstructive sleep apnea than people who don't. And when nasal obstruction is corrected, sometimes there are improvements, objective improvements in their sleep apnea, but not consistently.
That's been my experience as well. So what I tell people is, I'll help you possibly tolerate your Cpap better. I might help your oral appliance work better, but I'm not fixing your sleep apnea.
That's true for most people. Interestingly, there have been a number of studies that have actually shown objective reductions in Cpap pressure requirements with correction of nasal obstruction, and the average is 3 or 4 points. And when we think about why someone might have difficulty tolerating their Cpap, high pressure is a major risk factor, and being able to reduce their pressure requirement may make them a Cpap successful user rather than an unsuccessful user. So I'm a very, very strong proponent of aggressively correcting their nasal airway obstruction as part of their overall management of sleep apnea.
So we've had about the same, came out of training about the same time. And when I started, we used to do more work on the palate, even trying things in the base of the tongue. And essentially, the success rates were bad enough that a lot of that's fallen by the wayside, except of course in people who have giant tonsils or very favorable anatomy. But more recently, there was some newer things where we can actually help stimulate the tongue. You want to talk a little bit about that?
The palate changing procedures were popular in the 90s, and for most people, it's not a good option. And the tongue-based reduction procedures are not popular, and there have been a bunch of other procedures that I don't even do anymore that never really work very well. But more recently, we have an option where we place essentially a repurposed pacemaker in the body that stimulates the nerve to the tongue, and that allows the tongue to move forward and out of the way during sleep. So the patient turns on the device when they're asleep, or before they go to sleep, and every time they take a breath, their tongue moves forward, and it opens up their airway, and therefore they don't have the apnea. So it doesn't wait for them to have an apnea, it just prevents the apnea from having. It's called Inspire, is the company that makes it, and they're based in Minnesota. And this has really revolutionized the treatment of sleep apnea, because suddenly, for a great number of people who are not able to sleep with Cpap, we have a very effective and safe surgical option for them.
How long is that surgery?
Surgery, nationally, surgeons average about 2.5 hours to perform the surgery. My personal times are now typically under 1 hour to perform the procedure.
And do they have to stay overnight in the hospital?
No.
And how long before they actually start to use that?
The device, when they go home, is off, and they begin using it 4 weeks after surgery.
And then what, so they would continue to use Cpap if they can tolerate it, or these are all Cpap failures?
Well, they come in two flavors. There's the completely intolerant patient who hasn't worn it in years because they couldn't stand it. But I have other patients who are struggling with it, and the reason they're doing Inspire is that the Cpap is just extremely disruptive to their sleep, but they're able to sleep with it. So if they're able to sleep with it, I have them continue until Inspire is working.
So there you have it. If you're super tired, snore a lot, and didn't wake up at 3 a.m., you might have sleep apnea. So thanks, Jordan and Ryan. So that's our From the Top, and we'll catch you in a few weeks.
See you later.